Did you know that dental health is the top-ranking disease condition that veterinarians diagnose? Many people don't know the role that TD plays in improving dental health and the role that it plays in the Hills Prescription Diet portfolio. This video will explain how TD is being relaunched in 2011 to address the growing awareness among consumers about the systemic health connection. The systemic health connection applies to pets too, and suggests that bacteria in pets' mouths can also be transmitted to other parts of the body, which is associated with causing disease. We'll be hearing from dental specialist Dr. Fraser Hale and veterinary general practitioner Dr. Robin Downing about the importance of oral health to pets and why every doctor and staff member should be recommending TD to all their patients as a maintenance food. This video will also show you the new tools that Hills has developed to support TD's systemic health relaunch and why you should use every opportunity to engage your accounts with TD.
Periodontal disease can be seen as a very complex mixed bacterial infection, one that cannot be treated with antibiotics. The oral cavity and associated structures are very rich in nerve endings, particularly pain receptors. So any disease in the mouth, inflammation or infection, is going to be very much felt by the animal and have a negative impact on their quality of life. Prevention of periodontal disease obviously starts before dental disease has developed. If we're going to prevent, we have to be ahead of the curve. We need to prevent plaque accumulation. We need to remove and disrupt the plaque film on a daily basis. There's an ever-growing body of evidence that chronic oral inflammation, chronic periodontal disease, does have negative impact on other organ systems and other parts of the body. Animals have to eat every day. If we can feed a diet that has been clinically proven to help retard plaque accumulation and it's nutritionally acceptable or appropriate for that animal's needs, then it just makes sense to also add that strategy.
It's important to remember these key points made by Dr. Hale. Periodontal disease cannot be treated with antibiotics. Disease, infection, or inflammation in the mouth is going to be felt by the pet. Evidence shows that chronic oral inflammation does have negative impact on other organ systems in the body. And to fight oral disease, we must remove or disrupt plaque on a daily basis. Now let's hear from Dr. Robin Downing, a general veterinary practitioner who's very successful at promoting nutrition as a way to improve dental health. She sells more TD than any other clinic in the USA and believes in the science behind the product.
TD provides me an excellent nutrient profile for maintaining adult and healthy senior wellness. Clients, by and large, will not or cannot brush their pets' teeth each and every day. So by allowing them to eat TD, we let them brush their teeth every time they eat because it's like chewing toothbrushes. So if we have the opportunity to reduce the bacteria load in the mouth, then we have the opportunity to reduce the risk that those bacteria will enter the bloodstream and cause problems with the organ systems elsewhere. What it really means is oral health and overall health are really linked, and it gives us the opportunity as veterinarians to help our pet owners help their pets each and every day. Right now, there is no nutrient profile that is clinically proven to as effectively reduce plaque and gingivitis in the mouth of dogs and cats as prescription diet, TD, canine, and feline. And so if we're going to follow the science and we're going to enhance overall health by enhancing oral health in our patients, helping them have better oral health for better systemic health, then TD provides us a tool to do that. But in addition, TD gives me a tool to practice better medicine. Because TD is available only from veterinarians, it gives me an opportunity to serve my client by providing them with an important health-related tool that is available here in my hospital and provides me with the opportunity to create a self-sustaining revenue stream.
Here are the takeaways from Dr. Downing. TD is an everyday feeding food that has an excellent nutrition profile for maintaining adult and senior pets. Oral health and overall health are linked. There is no nutrient profile that is clinically proven to reduce plaque and gingivitis as effectively as TD. Eating TD is like chewing toothbrushes, and lets pets brush their teeth every time they eat. TD helps vets practice better medicine by enhancing oral care. And remember that TD is only available from veterinarians and creates a self-sustaining revenue stream for clinics.
One of the most effective strategies that we as veterinarians can utilize to help our clients get the messages we're trying to deliver is to show them what we're talking about. We take a screwdriver and we take liquid correction fluid that represents that thin layer of plaque bacteria that will accumulate on the teeth. So I'm going to take just a kibble out of this bowl of grocery store run-of-the-mill dog food, and I'm going to lay the screwdriver against the kibble and pop the screwdriver through the kibble, much like the tooth will pop through the kibble when the dog eats. And you can see that the correction fluid at the end of the screwdriver is virtually untouched. It hasn't really done anything to remove that thin layer from my screwdriver. So now I'm going to do the same test using correction fluid on my screwdriver and a kibble, this time of Prescription Diet TD Canine. And what I'm able to show my client is that the correction fluid is actually captured by the fiber matrix of the TD kibble, and we can see now that the end of my screwdriver is perfectly clean because that correction fluid has been squeegeed from the metal, much like plaque bacteria will be squeegeed from the surface of the tooth. So one of the strategies for us to help our clients understand the importance of using a nutrient tool like TD is to show them the benefit. When I look at Opus's teeth by opening his lips, it doesn't look too bad in that mouth. Gums look pretty healthy. There's a little bit of residue on the teeth, but that wouldn't be a very compelling message for my clients. So I'm going to rely on an instrument called the QLF dental exam tool. And QLF stands for Quantitative Light-Induced Fluorescence. And this QLF dental exam tool allows me to show my clients in no uncertain terms that when they have the bacterial byproducts of plaque on their dog's teeth, it shines with pink fluorescence.
Here are the ways QLF can benefit a vet's practice. QLF is a powerful visual way to show clients plaque and evidence of oral bacteria in the mouth. Using the QLF tool increases the opportunity to make a treatment recommendation because consumers will see evidence of bacteria in their pet's mouth. Use QLF alongside materials such as our UV Dental Exam Tool Companion Evidence Card to better show evidence of bacteria on the surface of the teeth. Using the QLF tool increases client compliance with appropriate recommendations for treatment, increases pet owner purchase, and it increases clinic revenue.
TD is not a fattening nutrient profile for us to feed. In fact, one of the benefits I appreciate in my practice is that TD is actually less calorie dense per cup than many maintenance products that are currently available. It's important to remember that TD should not be fed as treats. It undermines the effectiveness of the removal of plaque and the reduction of gingivitis if we only feed it as a treat. It's almost like a human being deciding they were going to only brush their teeth on Monday, Wednesday, and Friday. This is Tommy. Tommy is a 12-pound Cavalier King Charles Spaniel. He not only has no problem biting through that big kibble, he really loves it. And so he is my best advert ever for helping our clients who have smaller breeds understand that TD can play an important role in their oral and overall health as well. Pets need dental care too, just like humans. And by enhancing oral care, we actually have the opportunity to enhance overall care. It's easy to make an effective recommendation when what we're really talking about is helping our pets live longer and live better.
Since there's really no downside to having a good periodontal preventative program in place, we should apply that to all animals. Then those that would develop periodontal disease without prevention in place will be kept healthier. Those that wouldn't have got periodontal disease regardless still won't. So it's a win-win.
We've heard from one dental specialist and one general practitioner on how oral health is important for overall health. Now let's review the key benefits of TD. Prescription Diet TD is the only pet food clinically proven to reduce gingivitis and accumulation of both plaque and tartar. TD's patented fibre matrix kibble works like a toothbrush to remove bacteria-laden plaque. And Prescription Diet TD contains clinically proven antioxidants to support a healthy immune system. With the QLF dental exam tool, veterinarians can very powerfully show patients the evidence of bacteria, which will motivate them to purchase TD or to get a dental prophy for their pet. TD is the only pet food that's clinically proven to reduce gingivitis and provides excellent nutrition for maintaining most adult and senior pets. To learn how you can get access to these new and exciting tools like the QLF dental exam tool, jaw models, UV ink detailers and instructions on how to conduct the screwdriver test, visit knowledgeconnection.hillspet.com and click on GMIT Bundle Book Community.